So we just recently had received the results for PRAGMATICA-LUNG, which was a randomized phase 3 trial, FDA registrational trial looking at ramucirumab and pembrolizumab versus standard of care. And the interesting thing about this trial is that it was run in a pragmatic way. The eligibility was very broad and only limited patients by the number of prior therapies they had. And if they were able to receive therapy as a standard of care, that was acceptable. And the standard of cares were anything that an investigator wanted to give the patient as a standard of care. So it was very broad and very, very wide. We were able to accrue a more representative population with about 13% Black patients in this study. The outcome, the final result, did not show an improvement in overall survival between the two options, though there were less toxicities with the ramucirumab and pembrolizumab. And what it really showed is that in less than 2 years, we were able to accrue over 800 patients, which is pretty unheard of in a lung cancer trial done through the NCTN. And so we think that the pragmatic design, even though the result was not a positive result, that the pragmatic design is something that could be followed, especially in the second line setting or the subsequent line setting where there are many combinations that want to be tested, and we've had many negative results. These are ways to get trials done more efficiently, include more generalizable population, and get the answers in an efficient way.